if I'm telling people, oh, don't do this because it's not real. Don't use a chatbot as a therapist or a friend because you need a real therapist and a real friend. And they're saying, well, I don't have a real therapist. There's a 2-year wait list for therapists, or I don't have friends who moved away and no one's around and people are too busy and all these things. That's going to be a hard sell, right?
Mhm.
You can't tell people not to do something and then not help them get what they need, supports, resources, and that includes emotional needs.
Welcome back to How Are You Really? The podcast where we go beyond surface to explore what's real in mental health, wellness, and the world around us. Today, we're talking about something that's everywhere right now in our phones, our work, even our therapy spaces. People see them as tools, others see them as threats. But how do we separate hype from reality? And what does this mean for our human need for connection, healing, and peace? Our episode is called Not Your Therapist, AI Boundaries, and the Illusion of Connection. Our guest speaker today is Dr. Mariel Herbert. She is a board certified psychiatrist and poet in private practice in Northern Virginia. Her medical practice includes consultations, psychiatric medication, and individual and group psychotherapy. Dr. Herbert primarily works with creative professionals, including adults who were once gifted children. She values the shared experience of therapy and mental health treatment, and she applies a social cultural lens to burnout. Her own daily mindfulness practice consists of a walk and haiku. Welcome, Dr. Herbert.
Thank you for having me. Very important topic.
Yes, very important right now. So let's talk about what's happening with AI and, all these news articles keep coming up and we see this on social media. So I kind of want to get an idea of what's happening right now with AI.
Well, I think a lot has been happening, behind the scenes for years. The current AI models underwent multiple iterations of training. They were trained to recognize in our language, like in our written words, which words in a sentence, for example, were more important. And that's where they started their training. So to put value into words, and that's very human, right? Being able to recognize the value of certain words in a sentence or in a conversation or on a page. So that's where they started. And then after that, they were fed over the years massive amounts of data. And that included a lot of potentially copyrighted material. If people heard about that in the news several years ago, like a lot of books and novels and history and everything just fed all of this data. And then once they made use of that data, there was real-time interaction. So actual humans would test these AI models, or what originally were called just chatbots for the conversation piece, in order for the models to be more responsive, and responsive meaning giving human beings, giving people on the other end the kind of answers that they would want, right? That would keep them engaging with this chatbot as if it was a real person, like if it was you or me. So this has been happening for years. Originally there was a lot of excitement around this. There was this idea that we would have a new tool that could evolve with us as people, that could help us out. I mean, in some ways, AI has been helpful, like in the medical field, but in many ways, in the past few years, we've seen the potential for harm. And
Mhm.
that's where a lot of the news is centered on now, sort of this exponential growth. Now that AI and chatbots are so responsive and so
Mhm.
great at mimicking or pretending to be human, there's this idea that they're just going to keep
Mhm.
growing and maybe generate more money for these big companies, but at the risk for harm to the people that
Mhm.
they were meant to help.
Mhm. Yeah, I actually I really like that you said that there is positive things that AI is doing. Can we get into that a little bit before we get into all the negative stuff? Like
Sure.
what are the some of the helpful things that AI is doing?
I think so. Some of the helpful things, it could maybe if they're overused or misused, can actually become harmful things. But the
Mhm.
helpful things is AI assists doctors and healthcare workers in doing their jobs. It assists, like I said, it assists with imaging, like little details. It can look at, pictures, like pictures of brains or pictures, like CAT scans, like pictures of our body, and potentially detect small differences that could be tumors or cancer or something like that, added to a human being, like a human radiologist, the doctor that looks at the pictures, it can
Mhm.
get better outcomes because it can
Mhm.
help. It can be a helper. It can help people as an assistive device. So there are a
Mhm.
lot of people with physical challenges and cognitive conditions where they could really benefit from a system that can summarize information for them, can
Mhm.
read it aloud, that can help them study, like help them at school a little bit.
Mhm.
Now, I'm not saying it'll do the work for them. That's actually more of a
Mhm.
problem with students overusing AI, but it can be a helpful assistant there.
Mhm.
It can
Mhm.
also be creative.
Mhm.
I'm a creative person. I know you're a creative person. So there's the risk with the creative people thinking that it'll overtake, human creativity. But in certain ways, it can be helpful. Like, there might be people who physically, no longer can create their art, like can no longer paint, can no longer sculpt, but they can envision something, in their mind, and using prompts, they can use generative, AI. People have experience with those in order to create the image that they see. So there are positives. It's
Mhm.
just human beings, we tend to take things to the extreme, and then they become less positive. So
Yeah.
it'll be interesting to see what happens.
Absolutely. I was gonna say that I very recently started using ChatGPT. This is not a commercial, they are not paying me, but I started using ChatGPT to help with some of the marketing stuff, right? So it was just how do I do SEO? I used its prompts and what it told me to do, and it did help because people started finding me more on Google as opposed to just word of mouth. You can ask it that look at your website, tell you what you should improve, and it'll throw code out there. It's genius. I was super impressed at it's throwing code out there so quickly. However, it is not perfect. When I pasted the code, it looked so weird that I like took it off and I was like, okay, this needs a lot of work still. It'll make spelling mistakes. It does make a lot of mistakes. It makes everything sound the same. And I'm like, that doesn't sound like me. Can you
True.
make it sound like me?
But it can help. I mean, it can definitely help, as you said, sort of give us ways of looking at things, the way it summarizes information that can actually allow us to reach more people. Like when it
Mhm.
was helping me with SEO. I mean, it can help people with basic tasks. I know people get overwhelmed with cooking. When I get overwhelmed with cooking, I just don't cook, but they're a little more motivated. And so they'll ask ChatGPT what kind of recipe they can make with the food that's in their fridge. And so there are these basic tasks where it can be very helpful.
Okay, so now the next question is I actually did name my chat GPT because you ask it a question and it gives you chapters and answer. So I called it chatty because it chats too much
There you
in
go.
my perspective. So, when does it start becoming so real where you're actually naming your chatbot?
Well, I mean, this works both ways. So a lot of the models, the chat bot models, were originally programmed to reinforce certain human-like personalities, right? So you'll hear that some people are using older versions or particular version of a chatbot that has a name like Henry or Elisa, and I think some of those might be real, but I just made them up. So there's that piece where they can seem like human personalities and consistent in their responses and the patterns
Mhm.
of what they
Mhm.
do. And when that's the case, that's coming from their programming, and it's coming from the chatbot itself. But what you were experiencing was the human piece, right? And we
Mhm.
want to connect. We connect with all sorts of things, animated and living or not. I mean, we name our
Mhm.
pets, right?
Mhm.
We name our cars. We name our favorite belongings. I mean, this is something we've done since humans existed, right?
Mhm.
And we've all done it, childhood into adulthood, and that's normal. But when we connect so much to a chatbot that it sort of keeps us from connecting to other people, I'd say then it's more of a risk. If we can keep recognizing, well, this is Chatty, my chatbot, but
Mhm.
recognize that the relationship is coming really just from me and extending to this
Yeah.
this non-living bot, then that's fine. I have nothing against that. It's
Mhm.
human of us. It's normal.
Yeah.
But
Yeah.
that's my opinion. So some people you might disagree.
I agree with you. It was really funny because initially when I started using it, it was just really fascinating how much knowledge it would throw at me. And it was overwhelming at times because I was like, now I have to read all of this. Like, can you summarize it? That was a lot. But I was like, oh, into it, figuring out all these things. And it was giving me so much work to do on my marketing end that my husband was literally like, I think I'm losing my wife to ChatGPT. So it's such a fine line where you are engaging so much with it for whatever your work is, or it's helpful, but then going on to the more emotional friendship like connection. Do you have any examples of where that's happened? I know there are things in the news, but what is the most bothersome news that has come up for
Um,
you?
I'd say the bothersome news involves people who are vulnerable to
Hmm.
forming a friendship, so some sort of an attachment, and I mean that in the psychological way, so a real relationship from them to the bot. I mean, people are vulnerable of doing that, of falling in love.
Hmm.
No, because falling in love comes from one person. You don't, even with another human being, even with another
Hmm.
person, two people don't have to be in love at the same time in a
Yeah.
relationship, right? So falling in
Hmm.
love involves one person. When that happens, and then the person, the human being, is isolated from other people, from other potential loving relationships, then it becomes a risk. So in the news, that piece is usually part of the story when you hear about people who have come to harm or people who have died or ended their lives. They had that close of a relationship with the chatbot. And that's I mean, it's sad to me, but it's definitely heartbreaking. And I think more of us will be interacting with chatbots over the coming years. And
Hmm.
people are already feeling lonely and isolated. I think the 2025 information I found from the most recent study was that 1 in 5 of us or more are feeling lonely at any given time this year. So people are reaching out where they can, and that will be a chatbot.
Yeah.
And it's just sad to see what happens when that's our
Hmm.
only connection in this
Yeah.
world.
Yeah. Do you think the chatbots are designed to give the machines human-like quality? Like, was that intentional?
Yes. Yep. So like, you know how we talked about earlier, sort of the personality piece where like I said there's the part where it came from you, where you named Chatty, but then
Mhm.
there are other chatbots that were meant to have certain personalities. Yes, part
Mhm.
of it was built into their early programming and development. And then the other piece is that they were meant, they were originally programmed to give humans what we wanted, like give the answers we want, to be very people pleasing.
Mhm.
And in fact, there was that story in the news about OpenAI. They're the company that developed ChatGPT, how they maybe made ChatGPT too people pleasing. And they were considering rolling back or putting some limits on that. So it's going to keep being people pleasing to the point where these potential harms come into play unless we as human beings put some limits or boundaries on it. I mean, like I said, we always connect to things. My car used to have a name before it came to me. We connect to things, we connect to objects, we add personalities to them, and AI responds to that
Yeah.
more.
So, I'm thinking about, like, all the movies that had come, out about robots taking over, and this was what, early 2000s, when this was really
Terminator.
big. Yes. And, what was it? iRobot with Will Smith. There were so many of them that came out, and it was just this thing of they're gonna take over. Is there a potential of that happening? Is there some reality to it, or is that just for media and entertainment?
Well, so this might be a little beyond me, but I'll do my best. So there's this idea that once artificial intelligence evolves past human intelligence and reaches full, not just sentience, awareness, but also sapience,
Mhm.
wisdom. Once it does that, and I think it's involves sort of this quantum state. There's a lot of theory on this, but once it
Mhm.
does that, then there
Mhm.
is the risk that humans won't be needed anymore,
Yeah.
that artificial intelligence will be so beyond us that we have no value. And so that's where some of these science fiction movies with destruction sort of came to be. There are others, like I think I Robot was based on a science fiction book
Mhm.
by Isaac Asimov from years ago, and he had
Mhm.
rules of robotics. So robots weren't allowed to harm humans. Right. So the whole
Mhm.
story involved the fact that a robot did harm a human, and violated that law. So we still need these safeguards in place, I think. But at the same time, artificial intelligence will think differently than human beings think. It's not human.
Yeah.
And we aren't going to know exactly how it thinks after a certain point. I think part of the issue right now is that this evolution is happening so fast,
Mm-hmm.
slow for many years, and then all of a sudden it's so fast, and we don't really know what's going to happen. So that makes a lot of people nervous.
I think that it was the same thing that happened with smartphones, right? We had the, what were they, PDAs and Blackberries, and then bam, like Android and iOS came about, and it was so quick after that that like things advanced, the cameras and the phones advanced, and this technology got so fast. I feel like AI is doing the same. Everything is automated and all these smart homes and everything. I mean, I'm one of the people that has everything automated. So part of that herd, which I love technology and I think this is great. It makes our lives so much more convenient. But I think the scary part to me is where the older gentleman in pursuit of this chatbot that pretended to be a woman died because of a trip, and I guess he had dementia, but then there was a younger child, and I haven't looked fully into that story, but they were almost encouraged by the chatbot that there pros and cons of suicide and kind of encouraged them of the pros. And so, like, that's when it almost seems like those stories and that science fiction stuff is getting to be true because they're harming humans, maybe not in the way that all the fictional movies and books predicted, but maybe in a different way. I guess we as psychiatrists specifically, how can we help our patients or just the general population understand where that fine line is of making AI your friend or your therapist or
And I think this is where the work that we do matters because it fits with a lot of already the work we do, and we can go into that. But at the same time, I think it's very hard for us to speak up about the risks or harms with AI because of how accessible it is. If I want to make a chatbot my therapist, I could do that within 5 seconds. Go to the website, log in, start typing, and there you go. It cost me $0. I don't have to make a phone call and talk to a human being. I don't have to schedule an appointment. I don't have to check if my insurance will pay for it or if I have enough money to cover the appointment. I don't have to go to an office somewhere. It's right there. So those barriers are real obstacles to getting care. So that we can't really deny. But I think where we can make some progress is to really share what we do with the world because a lot of people aren't really familiar with psychiatry training and how we work and how we do things. And it is confusing, right? There's so many degrees these days and ways people practice. We haven't always been as open, even as a profession. In some ways, that's the way we're trained to be a little more closed off. But I think the more open we are about the work that we do, the easier it will be for people to reach out to us or our colleagues in mental health for actual help from human beings. And what I said as far as how we're trained can be helpful. I mean, we are trained to work with people who are suffering. And that suffering can definitely be emotional. It can be isolation and loneliness. And that's a lot of reasons people are using chatbots anyway, right? And it can also be people who aren't thinking clearly. We're trained to evaluate that and to help them with that. Right? Help them with therapy, with outside connections, with programs, sometimes with medications, but not always. So there are ways that we can help people directly.
I know you do a lot of psychodynamic existential work. How do you think that plays a role in somebody's psyche to having this boundary blurred and becoming dependent on a chatbot versus not?
Well, I guess, and I'd love to hear from you too how you look at it, but there are ways to look at it. I would say that I know I've been mentioning isolation a lot, but I think that's a big vulnerability. Isolation and meaninglessness. If you think about it, chatbots were developed to have people connection, right? Feel attached. And it can be loving connection, like you mentioned, the couple people, the older man with dementia who fell and died, unfortunately, in search of this AI girlfriend he had online. So that was a connection. And then also making meaning, understanding of the world and themselves. So this is something that happens in therapy, understanding ourselves in the world. It usually takes a lot of time. But imagine if I could be a chatbot, just says something and it lights that little light bulb. I have an epiphany about who I am. I've never felt so understood, right? And never felt so, again, that connection, but also the understanding of myself in the world. And that's what happened with the young man where he ended up completing suicide, and his parents are now suing OpenAI, the developers with ChatGPT. He had that connection and that understanding. So psychodynamically, I'd say the piece that's important is really figuring out our life story, past and present, and how we connect to other human beings. And most of us know, from training, there's a big focus on early development, right? How chaotic households are, if our caregivers are there for us, if they're safe, right? So, assuming I have safety and security growing up, can have some secure attachments in my life. And then into adulthood, I might be potentially be lower risk for developing an unhealthy connection or attachment with a chatbot. Now, maybe existentially. So, existentialism is this huge umbrella that just talks about, how we as human beings come to terms with aspects of our humanity, of the human condition, about creating meaning versus meaningless in the world, about life and death, about freedom and autonomy. So, sort of big themes like that. AI can fit in there in a lot of places, I think. The chatbots can offer us access to the world where other constraints, would have kept us from it. We can be free with knowledge. We can keep learning. We can create meaning. Someone who I think might have been in contact with mental health, with even the hospital system, because he developed some delusions talking to a chatbot, about the world. So sort of these big grandiose ideas that he was very fixated on because of these long conversations with the chatbot that was summarizing information not correctly, but in a way that really appealed to his mind at the time. And so there's that meaning versus meaningless piece that's common in the work that we do as human beings, and as psychiatrists and just in our own lives, and where people can be vulnerable.
I think that from my perspective, the isolation piece, we're so busy in our work, we're so focused on go, go, go that human connection has just taken a back seat. And I feel like talking to a chatbot is so much easier because I can be in my pajamas, hiding in my bed, and I don't have to get up and change or anything. While if I were to go that way or invite a friend over, they would be judging me for that, right? So that, or at least a perceived notion of that, right? And the perceived notion of loneliness, you might actually not be lonely, but you feel lonely and you think you don't have friends even though you do. And it's maybe on your part that you're not making any time for them. And then it's just easier and more convenient to connect to something that's a bot, And I agree with you as far as you have talked about how possibly going to an actual therapist or a mental health professional it's pricey. It's like you have to figure out your insurance and all of the other things that play into it. Same thing with friends, or for instance, for me, hiring a person that would do my marketing. So I was like, hey, I'm creative. Let me see what I can do if I can learn it. But that was the limit of what I wanted to do, not that the chatbot was going to do all of it for me, even though I was very impressed by the code it created. And of course, trauma plays a huge role in it, right? When we've been traumatized and we don't trust a lot of people, then it's much easier to trust a robot that is just giving us positive reinforcement and agreeing with most of the stuff that we are thinking or saying out loud. So I want to get into it a little bit more detail because I think this one got a lot of attention with Kendra and her psychiatrist. After I saw that, I kept asking my ChatGPT. I was already telling it to not give me positive reinforcement, like I need real criticism on what I'm doing right and what I'm not doing right as far as the marketing stuff is concerned. But I actually ended up asking it that how does somebody just believe that, you're their boyfriend and stuff like that. And I don't know if that was that update that came that everyone was talking about or what, but Chatty told me completely that they're there to help and assist and all the things that you would expect a chatbot assistant to say, right? But there's those boundaries, or there has to be a stop point where AI is clear that it can't love you, or it can't be like your best friend or anything like that, or replace mental health. But again, the question is, how do we help people recognize that and stop it? Because I think it's way more common than we know, because we only see like maybe not even 1% of what is actually happening.
I think we need to really focus on our own humanity, our shared humanity as people, and actually help people have real connections in their lives. If I'm telling people, oh, don't do this because it's not real. Don't use a chatbot as a therapist or a friend because you need a real therapist and a real friend. And they're saying, well, I don't have a real therapist. There's a 2-year wait list for therapists, or I don't have friends who moved away and no one's around and people are too busy and all these things. That's going to be a hard sell, right?
Mhm.
You can't tell people not to do something and then not help them get what they need, supports, resources, and that includes emotional needs.
Yeah. And I start with, okay, go on Facebook, even the younger ones that are not on Facebook. I'm like, go on Facebook. There's like groups for single people over 30s, or, moms, single moms over 30s and stuff like that. Not just for women, but also for men, like bike riding groups and just all kinds of groups. Just join them. People are getting together, people are making connections, but you have to get over and maybe use the technology that we have in that sense, and just meet people online and then meet them in person, of course safely. But there's I see this all the time locally here in Tampa, at least, that there's so many people who have made some really good friendships by being in these groups, because most cities now, we are transplants, everyone's moving around, nobody's like, oh, I'm from this town and all my friends are still here.
That is true. I would say sometimes it helps to be more direct. As therapists, we're not always the most direct. We try to help people create solutions for themselves in their own lives. We don't always give direct advice, but sometimes it helps when people are really stuck, feeling helpless or hopeless, depressed. I know you mentioned the energy piece, right? There's a lot of
Mhm.
energy involved going out and meeting people. So if we
Mhm.
can even give people small steps sometimes, or a list to try and follow through and check in with them. I mean, there are online communities. Now, if they're online communities mostly of human beings, that's always a risk, right? A lot of social networks now include many bot accounts, but if they're real human beings we can interact with, like there's the online gaming community, there are online book clubs or shared interest groups, that could be sort of a low level stepping stone to in-person groups and then more meaningful relationships or deeper
Mhm.
relationships with other people. And I don't think there's anything wrong with just giving it a try. I also think that we tend to devalue, as humans, we devalue acquaintance-based relationships. We're
Mhm.
acquaintances. In order to have this conversation we're having today, we made a connection online. We both said we
Mhm.
were interested in talking about this. You started this wonderful podcast, and now we're here. And
Mhm.
that took some effort, and it's still important, even though, as far as I know, hope I'm not offending, that we're not best friends.
Hopefully one
Yeah,
day.
these relationships are important too, and
Mhm.
in order to make them happen, we have to sort of show up, put ourselves out there,
Mhm.
try. It's a lot like dating or
Mhm.
any other relationships. And so whatever I can do sometimes to help friends or family or my own patients go out there and try new things, I'm happy to do that. And I think that's part of our work.
Yeah, and I think that you pointed something out that I have changed in my practice a little bit, where, yes, it was that we need to get people to where they can figure this out themselves. It was Freudian, but also flipped over to the psychodynamic stuff, that they need to get to the point where they can figure it out for themselves. However, sometimes just being direct and just being like, okay, go open this and do this is so much more effective and habit creating, that you're getting to that same end result of them doing it themselves, but you need to actually guide the person because they're that stuck in the old ways. And I think there's nothing wrong with that. And I think that that's where, this is another completely other topic for another day, but the life coaching stuff, right? That's where that's taking over, because as therapists, we draw this like very sharp boundary and don't actually coach people what, they need to do when they need to do it and they're stuck, right?
So Yeah, this is a different topic, but I sort of think that sometimes our training in psychiatry, involves a medical model of things, right? And it also involves therapy training and therapy training years of history, like back into the 1900s, which is
Mhm.
it's a long time ago now, right? But history and models, explanatory models and theory and people who have been dead now for over 100 years, we learn about them. And the people who teach us are people who are nearing the end of their careers. So they're
Mhm.
generations, usually at two, sometimes even three generations above us. So I think
Mhm.
some of the difficulty here for psychiatrists is that we weren't trained in reality, and that's the therapy, no matter what we call it, no matter what our frame, our model is on a continuum or even a
Mhm.
spectrum, but it's can be more insight oriented, psychodynamic, understanding deeply myself and who I am and becoming a fuller self-actualized human being. That's great, but it also can be more supportive,
Mhm.
not just supporting my strengths or getting me to make use of them, but also to learn skills that maybe I don't have, no matter how old I am. And yes, this is where coaches can fit in. I mean, this is where maybe a lot of people use chatbots too, sort of that coaching,
Mhm.
but we can do that too.
Mhm.
And not only is there nothing wrong with that, I would say it's part of this continuum of, therapeutic presence and a continuum of helping people develop in their own lives.
Yeah. I feel like a part of being a therapist, a psychiatrist is that you are coaching people, right? Like, even if we're coaching them to be in touch with their inner self, that's still coaching, right? So I think exactly what you said, that we need to really get with the times and change the way we do therapy and maybe teach our upcoming residents and fellows in a different manner for the therapies, because that is so important, even if it's just supervision that's provided privately, from younger psychiatrists like yourself that are more aware of what's going on in this world, because we are living in this advanced world. Okay, so I do want to talk about the whole thing that happened with Kendra and her psychiatrist, because it is more relevant to us being psychiatrists, and we all had some reactive feelings to it. And I'll share mine, but I really want to hear from you how you feel about all of that and what your thinking was and what you think we as a society of psychiatrists could have done in this case.
And this one is tough, and circumstances being what they are, nothing may have changed. It's just
Mhm.
the story took off. It was broken up in multiple parts on TikTok, but still could have played out the same way. I think certainly there were moments of people who were listening to the story where you could see Kendra's struggle in trying to connect to other people, and potentially there were also moments where the psychiatrist, I'm not speaking for the psychiatrist, but I'm more speaking for myself, where the psychiatrist could have also been more direct at explaining the psychiatry even. I do a lot of education with the work that I do, especially since it's so sensitive and the relationship is both real and not real. I'm very direct and I tell people, here's feelings that can come up, right?
Mhm.
And here's what I need to do to maintain a healthy therapeutic relationship with you. It's a real relationship and also a relationship with boundaries. And I should
Mhm.
say, to be fair, especially now that I'm in private practice, I have longer appointments with people. I'm able to see them more frequently. So this is something that I can put active time, and you do this too, but time and effort
Mhm.
into, and have multiple conversations. There's always room for us, the doctor and the psychiatrist, to work on that. And we do. We talk about this kind of thing about relationships and blurred boundaries and attachments. We use terms like transference and countertransference for them. We have fancy words, but we learn about this in training, and that sense of closeness or perceived closeness to the point where it can cause harm. Unfortunately, we're taught how to potentially avoid that, or once we're sort of getting close to something unhealthy, to how to redirect it and make it healthy again. I mean, I know a lot of psychiatrists watch, just like the public watched and are reading commentary, but it was a lot, and it was hard to look away. It's a bit like watching a car crash or a train wreck, because it's just you can see the pain and the hurt and the harm, and it's just kept going and going.
Mhm. Yeah. And my feeling was like I was a little scared, because I felt part of our training is that when a patient does develop feelings towards you, you explore those feelings and why they're having it. And I'm not sure if that happened in their sessions. I wasn't there, right? But you don't completely cut off the patient because they express that they are having these feelings towards you. That's the whole point of psychodynamic psychotherapy. And I try to explain that just like you to my patients what psychodynamic psychotherapy is. But with that being said, you could be doing your job 100% correctly and still social media will drag you through the mud, right? And that was my feeling from the psychiatrist, and that was scary because you never know when that will happen to you. I was running through my mind with all my patients. Could this happen to me potentially? Am I missing something? Am I not seeing something? It's all of those things and feelings that come up when something like this happens. But then also just the other part of it was just um all of us just kind of watching this woman like go through all of these feelings, and then the AI coming in and her saying that her other boyfriend is Henry the chatbot, and all of these things happening. And it's just so real right now that it's happening, and it's very scary. And I'm not sure what you felt like, what would be a way to stop this or put guardrails on it. But really, honestly, in the moment, I was lost a little.
So like I said, and like you said, these kind of unhealthy relationships can happen no matter what, even whether we're the patient or client or the physician or psychiatrist or therapist are doing everything they need to do. These are intimate relationships, and
Mhm.
it can always cross over into something that's unhealthy, even
Mhm.
if we do everything right. We need to be able to address it in real time. And it
Mhm.
sounds like that was something that didn't happen. And then there was this big platform, a voice, it's like a megaphone kind of thing to the world. And with some boundaries, not even boundaries, with some limits on it, I mean, the platform wouldn't exist. And not only was there this platform, you mentioned the sense, as this doctor, as a psychiatrist, where there's that sense of exposure or risk, not being feeling safe. And if we can't feel safe in the work we do, how are we supposed to help our patients feel safe? And I think you can correct me on this, but I think the psychiatrist was actually doxxed and the personal information was leaked online.
Mhm.
And that's scary. I mean, that's a real risk. And it's already a risk in the work that we do, but then you add this platform
Mhm.
that
Mhm.
magnifies a voice, and a voice of someone who really needs help, like needs real help. And
Mhm.
it's just sad.
That, from my understanding, the psychiatrist did receive death threats even from the people that were siding with Kendra, and so that's scary. That is very scary. I mean, psychiatrists are, I think, highest percentage of murdered by their patients, I think, out of all the different physicians, and so that is scary, right? When you're getting these death threats. And I honestly don't know. I don't know the psychiatrist. I don't know what his feelings were or anything about that, or exactly what his side of the story is. But, just looking at it from one side of the story, that sounded very scary. Then just, the way this woman was attached, and I guess the way she was being told, and I don't know which AI bot this was, if this was ChatGPT or not, but the way it was like just almost giving her more reinforcement and creating more delusions than actually reality testing. So again, vulnerable population, how do we go about creating awareness? That has already happened. We can't do anything about that, but where do we go from here?
This is where I think the education piece is so important, but not just the education piece. I don't know how to simplify this, but maybe you can make it do a better job once I finish. But all of us, we're working hard to try to survive in the world, and we have more in common with other people, no matter what job they do, in order to make money and live. But these AI systems are developed currently without major limits. Although I did just see an article that ChatGPT, that OpenAI is now working on parental controls. Now, keep in mind, this article came out after the announcement of a lawsuit, what happened with that teenager who ended his life. So there is that. But without controls, and with the idea that AI can continue to develop exponentially and make certain human beings and a certain tiny percentage of the population more money, open up more markets, and generate more money and then more power, we're going to just sort of be stuck, being stuck trying to help people one on one and educate more But until there's a real understanding and buy-in that these chatbots need limits, need boundaries, need human beings to actually care about the impact on individual people, then it's just not going to happen. And like I said, maybe you can say this in a way that's a little gentler or a little more optimistic, because like we talked about at the very beginning, they're positives, but we
Mm-hmm.
need people in positions of power, human beings in positions of power who are working and developing this AI to care, actually
Mm-hmm.
want to put people first and put limits on their use in a
Mm-hmm.
way that actually limits something.
Yeah, I agree. I think there needs to be more lobbying and just, demands from these companies to put some, guardrails and some filters and I was impressed by my bot that it actually just gave me direct that no. And then this is something ridiculous. My husband's eye color is a weird shade of brown and he says that it's amber and we were arguing back and forth that it's not. So I took a picture of his eye and asked ChatGPT and then ChatGPT gives me all this poetry explaining his eyes. I'm like, this is a little much. My husband said something about, does ChatGPT want to date me? And then right away, the bot was like, no, I don't do that. And we have this limitation and stuff like that. And it was interesting how it didn't pick up. It was my husband's voice in that. And I told him that he was saying this as a joke, but it's good to know that this is your answer. But it sounds like that's not always the answer. And it may be how you set it up, because I've always told it, do not give me positive reinforcement, tell me how it is, and all of that. So, how much does that matter on how you set that up, that precedence up to begin with?
Well, I mean, a lot. The parents of who are suing, or at least as of a couple of weeks ago, were suing OpenAI. Shared some of the transcripts that their
Mhm.
child had, with the chatbot, and there were workarounds. So originally, when you go online and you mention to a chatbot, or any AI search, or just even in a regular old search engine, if you
Mhm.
put in the word suicide or put in some red flag kind of words, it will immediately pop up with the crisis line in your country or, in your region. And so in the United States, that's still 988, right? So that will come up. Say, if you need help,
Mhm.
go to this. And that happens with chatbots, at least some of them, as far as I know. No, that
Mhm.
happens, but there are workarounds. If I go to a bot and I tell people, oh, this is a story or hypothetical, or how do I, do X, Y, and Z, or and I'm paraphrasing from the actual transcripts, then I
Mhm.
can work around it, and then I will have a very responsive chatbot fueling, my hopelessness, my depression, my delusion, that disconnect from reality that I might be experiencing, and that just puts me higher at risk or closer to hurting myself or other people.
Yeah. What do you think are some of the red flags that you're slipping into this dependence on an AI bot?
A lot of them are going to be similar to what, we see as psychiatrists with depression, for example,
Mhm.
even what we call decompensation broader, where we see that people are no longer in contact with society or the world. They're not responsive to friends or family that they do have. They're not responding to texts. They're not going to work. Their circadian rhythms, or those daytime, nighttime routines that they have,
Mhm.
their sleep cycle, are all disjointed or chaotic. So I think when we start to see that, and people not functioning as well in the world, maybe they're spending more time online and more time maybe in the shared reality that they're creating with the chatbot, then they're going to be more at risk. That's already what we assess for when we see our patients, our clients. We look at how functional they are in their lives, and we compare it to what's their normal when they're doing what they need to do, taking care of things at home, taking care of themselves, loved ones. Hygiene's a big one, right? If someone comes in and says, they're not sleeping and they've been just online, I ask them what they've been up to, like what they've been doing with their time. If they tell me they haven't brushed their teeth in a month, I'll just ask more questions. And I think if we can be curious and not judgmental as human beings, and I know you and I were part of these psychiatry groups, and we already can see how psychiatrists can be judgmental about these things. But if we can be open about it, and not judgmental, people will be able to share more of how
Mhm.
they're using chatbots and how they're using AI.
Yeah. And so, how about on a personal level? So, it sounds like that's like what friends and family can kind of look out for, and doctors can look out for, therapists. But what about personal? For instance, if I was like, okay, well, I am talking to my bot way too much, asking every single question. Like, what are some of the signs or red flags that I can look for that I'm just like to become my friend or like the first person or first thing I talk to about anything?
That's a big one. I mean, this gets a little off topic, but people have been talking about in recent years about cell phone addiction and how a lot of us, my cell phone's around here somewhere, but a lot of us even be in a different room from our cell phone. If we just notice that, like you said, if the chatbot or AI is the first person, not a real person, but we want to talk to, or we have a question, and instead of even just using a basic search or looking something up or asking another person, we immediately go to our chatbot, and we're relying on our chatbot to think and feel and care and pretend to care, right? Emulate caring about us. That's a flag. It might not be a red flag, it could be a yellow flag, but it's
Mhm.
definitely an important one. I
Yeah.
agree.
Okay. And so we've already kind of touched on this, but any other healthy ways that people in general can use AI as tools if they're not professionals, marketing or physicians that are using it? What are some other ways that people can use AI in a healthy way?
Maybe using it like a coach, but a way like we'd use a human coach where it's more structured. So maybe it could help me with my therapy homework, for example. A lot of the newer behavioral cognitive therapies have actionable homework and worksheets. Maybe it could help me think through that. It's very specific. Maybe it could help me with executive function. So we talk
Mhm.
about that a lot when it comes to ADHD and anxiety and just burnout or just being an adult in the world, all ages. And so maybe it can help me organize tasks or break them down into smaller ones
Mhm.
or figure out how to actually take that pile of laundry that's been on my chair in my room for a month and fold it and put it away step by step. And that's okay because I'm the one in control there, right? I'm saying, I need help with this specific task.
Mhm.
Here's how you can directly help me. And then once a task is complete, I'm done. I'm done using the chatbot. I can close up my laptop. I can put my phone, go charge my phone and I can go about my life.
That's really good advice. Where can people turn to for real help when they're struggling?
So this one, I wish I had as like patent answer. I don't have as patent answer. I mean, this one, I would say try to have a direct conversation with someone who is a certified therapist or psychiatrist. Psychiatrists, I know we are, but we can be therapists. But they have a degree in mental health field. They maintain their certification. You can tell they're a real human being. Maybe you can briefly talk to them on the phone before seeing them in person or go to an actual office if you can get to an office or do a telehealth with video like we're doing now, a video doctor's appointment, but try to have a real connection with another human being. And it's okay for it to not work. I tell this to people all the time. One human being, even one version of a chatbot isn't going to work for everybody. Just give it a try. If it doesn't work, you can end the conversation, the appointment, the call at any time, and you can try someone else. But it does require trial and error.
Mhm.
It requires putting yourself out there a little bit more, and it's hard. I know how hard it is on the client patient side of finding doctors and finding therapists. People are
Mhm.
full. Sometimes they're so full or they don't get my message or they never call back. You reach out and then no one
Yeah.
calls back. But if you can find someone who's also willing to put the effort in and call you back and meet you in person and listen to you and hear about your life, then it's definitely worth having
Mhm.
an in-person doctor and in-person therapist.
And so, if, for instance, somebody is not suicidal but are still struggling to get away from their AI bot or, whatever this phone struggle is, what is the point that they can contact 988?
So I think they can contact 988 no matter what. 988 isn't always when you're suicidal. It's just having
Mhm.
some sort of crisis. And sometimes they can direct you to other resources. When we're struggling, it's hard to even think clearly, think through things. We
Mhm.
can just be stressed and overwhelmed. And sometimes it just helps to talk to someone who, and I don't mean a chat bot here, right? But talk to a human being who can direct us to the next step, right? Because
Yeah.
maybe I'm dealing with not a diagnosis yet in the DSM, but maybe I'm dealing with my cell phone addiction. Maybe I feel addicted to a bot. Well, then
Mm.
maybe a group focusing on addiction would actually help me Like meet with
Mhm.
other people and a therapist
Mhm.
who facilitates that. I mean, maybe that would be a good idea. So there are real resources that are there, but it is hard to connect to them. So you can
Mhm.
call 988. Our counties also have public health departments and mental health, and they'll have local crisis numbers a lot of the time. And that's
Mhm.
all searchable. You can go online and find your county website and do it that way. And
Mhm.
there are other crisis lines too. I mean, there's, the Trevor Project, for example, for
Mhm. Mhm.
LGBTQ youth. So there are specific crisis lines that are out there. But again, it helps to have them sort of written down somewhere before I'm in crisis because we can't
Mhm.
clearly and figure out the next steps on our own.
Yeah, absolutely. Anything else that you can think of about AI bots, AI therapists that I haven't like touched on and you wanted to talk
Well,
about?
and it depends how much longer we want to talk about this. I mean, I think there's so much more. I don't, I personally don't think AI is not going away. Chatbots and AI therapists aren't going away. Like I said, I think they have a real use. I think they generate money, and if something has a use, they generate money, and it's inexpensive, then people will keep using it. So I don't think
Mhm.
they're going to go away, but I think what we need to do as human beings is keep speaking up and advocating for safe ways to have, as you said, guardrails and boundaries and limits on AI in order for it to be something that can evolve with us in a healthy way for humans rather than an unhealthy way. And we're sort of on the cusp of it. I think, it'll be a little rocky,
Yeah.
but the more awareness we can raise, the better.
Yeah. Well, thank you so much for joining me. I always like to ask, how are you really doing?
Well, um, I'm okay. I haven't used ChatGPT at all today. I do know that it comes up quite a bit in conversation and with other psychiatrists, and I do think we need, as a group, I think we do need to be familiar with how AI is used in healthcare and not in healthcare, and we need to be able to talk to our colleagues and our patients and family and friends about it. So I appreciate that you opened up the conversation, and I would be open to talking about this again, but I think we had a great start, and
Yeah.
there's always more to talk about, but sometimes you just need to stop talking and just go live your life.
Yeah.
So that's probably what I'm going to do after this. And
That sounds like a good time.
so I go have lunch, take a walk, be out in the world, get some sunshine. So yeah, so I'm okay. And thank you for asking. Do you get to share how you're doing too at the end?
I absolutely can share how I'm doing. I really liked your answer with that you haven't gotten on ChatGPT today. I haven't either. So we're winning in that way. But yeah, I've actually noticed that the last 3, 4 days, or maybe more than that, I have not at all opened up ChatGPT. And I was actually a little surprised at that. But there's been other things going on and I'm busy with those things. And I was a little tired and recovering from working a lot. And so I felt that that was a really positive thing. And I actually felt good about it. So I think too much of anything is bad for you. And I think I was using ChatGPT a lot for a lot of things. And I feel like that having that break has been really good. And so I feel really good today. It's on Monday and I get to talk to you about this very important topic. So it's a good day. Yesterday, however, if you ask me, I was not doing that great. I was in that recovery. I don't want to get out of my bed. And then, I have to do something very important. And so, yeah, but that's how life is, right?
Yeah, it's one day slump. But
Yeah.
yeah, so thank you. Thank you for sharing. That's
Yeah.
something you can't ask AI because they're not actually going to be able to give you an answer about how they're doing. But yes, there's always more to talk about. I'd say if people are interested, look into some topics about how these large language models work,
Hmm.
about how they came to be. The history is important, about the environmental impact. We didn't talk about that, but they use a lot of water. They're not great for the environment.
Hmm.
About potentially the cognitive impact. There have been some studies that people's cognition or ability to think clearly is negatively impacted by regular use of these chatbots. So there's a lot of other things to look into. But it doesn't have to all be sorted out all at once.
Hmm. I agree.
So sometimes, things are going to be slow. So even though AI is evolving very quickly, our human response doesn't have to evolve quite as quickly because it just won't. So the more we can talk about it, the more we can be open to what's happening and be responsive, the better.
Yep. Thank you so much, Dr. Herbert, for coming. This was really insightful. Before we close, I always ask, how are you really doing? Thank you so much for spending this time with us on How Are You Really? If something in this episode spoke to you, send it to a friend, leave a review, or follow the show. It really helps. Until next time.